Thank you, Madam Deputy Speaker. And I'd like to take the opportunity to begin my speech by agreeing some general agreement about the state of the NHS. It was a Liberal idea, delivered by the Labour Party and then broken by the Conservatives. And we can see from their attendance in the debate here today how much interest they have in trying to fix it. We will act as that responsible and constructive opposition to work with the government to fix the many problems we see in the NHS. No, I won't, thank you. Solving the crisis in access to primary care matters not just for patients facing traumatic situations, but for our GP surgeries themselves, who are striving to do their best under the most difficult of circumstances. Our hard-working GPs dedicate years to train and work hard at what they do because they are passionate about being there for their patients. For too long they've been let down, and it is our job now to give them the means to continue doing their remarkable jobs. We know the difficulties. Too often appointments are not available, and patients and staff experience frustration and conflicting priorities in attempting to access services. For patients, this often means resorting to dialing 111 or even 999 and attending A&E when issues escalate. This puts further pressure on our already overstretched NHS emergency facilities, which too often have to deal with issues that could have been fixed by preventative primary care if patients could access it in a timely way. GPs in Sutton and Cheam are telling me that due to the level of demand, requests for appointments are triaged and decisions have to be made to prioritise patients with increasingly complex needs, often with very little information available. Unsurprisingly, this is affecting their mental health and also making it increasingly difficult to retain experienced staff, further eroding the ability of practices to keep up with demand. The ask from GPs in my constituency is simple. The Minister must quickly act to increase their budgets and offer certainty that will allow them to financially plan ahead after a sustained period of real-term cuts in funding. This will allow them to hire and retain more staff at competitive wages in this cost of living crisis, lower the collective workload and treat more patients more effectively. It is not enough to simply offer more training places or incentives to train if surgeries cannot employ the GPs who are already qualified and available, as is a particular problem in my constituency. If our GPs cannot compete with the private sector on pay or with overseas governments who attract our doctors with improved conditions, a lower workload and even possibly better weather conditions, their legend has it there are places that have even more sun than Bournemouth, apparently. We cannot hope to retain GPs in the NHS. We must make it easier for foreign students who have studied and qualified in the UK to get right to remain after their course should they wish to do so. As this new government searches for ways to boost growth, I say that this is here in front of them. There is no better investment in our future growth than good quality primary healthcare, keeping patients healthy, able to provide for themselves and their families and live healthy and fulfilling lives. Thank you.
Jen Craft.